And first at 10, a Dayton father is behind bars tonight after his 13-year-old son reportedly overdosed on the dad's heroin.
It's a problem Montgomery County officials say is sadly on the rise. 2 News reporter Ethan Fitzgerald here with us now on more on how the opioid epidemic is affecting the children.
You know, as this overdose crisis continues, kids are now being caught in the crosshairs. In this case, a 13-year-old found and used his father's drugs, ending in an overdose, and a father facing charges of child endangerment.
There's always concern when parents or relatives are in the household and they use prescription drugs or they use illicit drugs.
Ann Stevens works with Montgomery County's Alcohol, Drug Addiction, and Mental Health Office and says naturally, kids are curious. Because of that, parents should keep prescriptions or any other drugs locked up and away from kids.
Especially with heroin, they can't get a hold of it, period. It constitutes child abuse. It's maltreatment of your child.
According to the CDC, opioid painkillers often lead to heroin addiction. Scott Weedle of Germantown knows the pain of losing someone to opioid abuse. His son Daniel died at the age of 30 and left behind 3 kids of his own. Today, his father helped introduce Daniel's bill to the Ohio House and Senate.
The medical community does more to contribute to the disease of addiction than it does to treat the disease of addiction.
The bill would require the state to adopt the CDC's guideline on opioid prescriptions. The guidelines say when the prescription should start and when it should end, along with the selection type, dosage, and duration of the opioid prescription. And as those overdose numbers rise, so does the need for Narcan.
Narcan is readily available. It's free. Some of the doctors will write a prescription. You can get it at a pharmacy.
You spray it up the person's nose.
Now, in this recent case, the 13-year-old was taken to a fire station for help, where he was given Narcan and then taken to a hospital. Now, I've talked to numerous emergency responders, and they're asking that if you believe that someone has overdosed, to call 911 instead of taking that individual to get help. That decision could be the difference between life and death. Ethan Fitzgerald, 2 News, working for you.